Bismillahirrahmanirrahim. Here Dr. Niazi, and today my topic is the same one which I discussed in previous my vlog, that was monkeypox or mpox. Today it's part 2. Today I will discuss about signs, symptoms and complications of monkeypox or mpox disease. This monkeypox or mpox disease usually affects children from 5 to 9 years of age. Anybody, any age, and any gender can be affected from this disease, but commonly children of 5 to 9 years age are affected. And there is rash on the mucous membrane as well as on the skin. Our internal organs and internal structure, they are lined by the tissue called epithelial tissue. Skin is present externally and is exposed to external environment, and internally there is mucous membrane. Mucous membrane is not exposed to external environment, but at some places like mucous membrane of eye, it is also exposed to external environment. So rash appears. This rash is painful and itchy. There is pain in the rash and you want to scratch it. There is itching sensation. It firstly appears on the face, then on the palms of hands, and then on the soles of feet, and then other parts of the body. Usually 50 to 150 rashes appear in monkeypox cases, but sometimes more than 200 rashes are there. There are 5 stages of this rash. Firstly, the red area appears on the skin or mucous membrane. It lasts for 1 to 2 days. Then this red area becomes raised. This stage also lasts for 1 to 2 days. Then it becomes vesicle. There clear fluid appears in this vesicle. And this stage also lasts for 1 to 2 days. Then is 4th stage. In these vesicles, pus appears, and these are called pustules. And this stage lasts for 5 to 7 days. And then is the last stage. These pustules, they dry up, they scabs out, fades out, and scars are formed, and sometimes permanent scars are formed, which lead to permanent disfiguration. And this stage lasts for 2 to 3 weeks. In addition to rash, there is fever with chills, you feel cold. There is lymphadenopathy, painful lymphadenopathy. There is a lymphatic system in our body. There are lymph vessels and lymph nodes in the body, in the abdomen, in the chest, but they cannot be palpated. But lymph nodes which are present in axilla, in cervical region, in inguinal region, when they become enlarged, they can be palpated. These lymph nodes have very significant role in diagnosis of diseases. So in monkeypox or mpox disease, the lymph nodes become painful, and you can palpate these lymph nodes in axilla, in cervical region, and in inguinal region. Then there is pain in muscles, there is headache, there is backache. Patient feels loss of energy, tiredness, fatigue, and flu-like symptoms, nasal blockage, cough, sore throat. These all are signs and symptoms of monkeypox or mpox. Now we come to complication. Mostly there are secondary infection of the skin, which result as a result of this rash. Then there are secondary infection of respiratory tract. Among these, pneumonia, the inflammation of lungs. Pneumonia can be fatal. Then there is inflammation of brain, which is called encephalitis. There can be encephalitis. Then as a result of inflammation of different structures of eye, there can be conjunctivitis, there can be keratitis, and it can lead to blindness. This rash in the mucous membrane of eye can lead to blindness of both eyes. Then there can be permanent disfiguration, especially when the rash is present on the face. So This was about sign, symptom, and complication of this disease. Inshallah, in the next video, I will discuss how this spreads, what is its treatment, how it can be prevented, and what is the role of vaccine. Till that time, please, I seek permission. Remember me in your prayers. God bless you. Take care. Allah Hafiz.